Okay, shall we make a start? We're at 2 minutes past 12. We've got 34 people signed up, so we're approaching 30. So maybe now is a good time to just jump in. And if anybody else joins us, they can catch up. So welcome to the seminar. This is a seminar about COVID testing and a vaccination update, and then to look at the support that's available around communities and individuals that might need extra support. So thank you one and all for spending your lunchtime with us. If you've got a sandwich, tuck in, don't be afraid. We are recording the first section of this event, so the machine records the speaker only, and we're just going to record the people who are speaking in the presentations, and then we'll stop recording when we come back together in 15-20 minutes time to have the Q&A for the rest of the seminar. So without further ado, please make sure your microphones are on mute. Please put your hand up if you need to go to the toilet, and I will hand over to Judith, who I think is going to start off along with Dr. Alison Harper to talk about an update on vaccinations and then the bee's knees, the information that we want about testing. Judith, over to you.
Thanks, Ian. Hi, everyone. I'm Judith Stonebridge. I'm a consultant in public health with NHS Lothian, and my role primarily is to lead and support the public health input into Edinburgh. I want to start off with a big thank you first. So thank you to EVOC for sorting this out, but thank you to all of you. And as you'll hear through the presentation, a lot of the work that's been helping us deliver our enhanced response to COVID has been because of the partnership work and the support and the commitment from folks like yourselves in this sector and in this space. Particularly, we've got universal offers where we tell people you can come to mass vaccination centres to get vaccinated, but the work very much now is about addressing health inequalities, and we know that those from poorest backgrounds have been most impacted, both in terms of the illness and those health related consequences of COVID, but also in terms of the impacts of some of the mitigations around housing and work and all of that. And you will all know that much better than us, and you are in that space working with those people, so helping us to get vaccinations and testing and accurate information to them is key, and we're really grateful for that. So the session today really is about us trying to get you up to speed. It feels like it's a bit of a complex landscape at the minute and a bit confusing, so I accept that. There's a lot of messaging, it's hard to keep track of, so we've tried to keep this simple, try to give you the latest available information. And really the key message is that getting vaccinated, getting tested regular and isolating when you need to is our route to stay well and to stay out of COVID and to stay in this normal space that we're starting to create. So that's the purpose of what we're trying to do. I'm going to hand over to Alice now, who's going to cover the slot on vaccination. So I'll hand over to Alice.
Great. So Ian, I think you are going to share the slides I'm going to talk through, hopefully. Yep, something's happening. Perfect. Yeah, lovely. So as Judith mentioned, my name is Alice Harper, and I'm a public health doctor in NHS Lothian. And over the past few months, I've been involved in the COVID vaccination programme, and really about what Judith was mentioning at the end, just trying to promote an inclusive vaccination programme so that everyone that's eligible can get their invitation and accept the offer if they would like to. And yeah, it has been very much a partnership approach with lots of different kind of stakeholders and agencies coming together to make that possible. So just the next slide, please. So just going to provide you a brief update about where we are now, and obviously if there's something that I haven't covered, there'll be an opportunity for questions at the end. So where we are there currently 3 different vaccines available in the UK, so the Oxford AstraZeneca, the Moderna and the Pfizer BioNTech vaccine. And the important thing is that all 3 of these vaccines have been through the same safety checks and they're all approved for use. There still will be some variation in the type of vaccine that people are offered, but we can provide the reassurance that people will be offered the vaccine that is appropriate for them. So that's based on things like your age, potentially your past medical history, if you've got severe allergies, or if you're currently pregnant. So for example, you know, the vast majority of our
Oh, Alice, you've frozen on my screen. Is it happening with other people too?
Yes, yeah.
Oh, we'll give it a second and see if Alice comes back. This is where we should put up the test card with the doll and the chalkboard. Do you remember? And the BBC Two and the music.
I'm old enough, Ian, to remember that.
If Alice doesn't manage to get back in, I can pick up the slides. I haven't written them, but I'm happy to present them. And so we'll maybe give her another minute, and then just to keep the meeting flowing, I'm happy to do that.
Thank you, Judith. Thank you. Let's see if Alice gets logged back on. Why did the bicycle fall over? Because it was too tired. There you go.
Ian, I wonder if we skip to the testing slides and we'll maybe do them, and then Alice may be back in by the time I'm finished. I'm just conscious of time. Would that work?
Perfect plan. Let's do that. Judith, you go next.
I think I'm back. If you can still hear me.
Oh.
Great. Sorry.
I'm so sorry. That's the standard of the joys. Perfect. So yeah, slide please. Perfect. So just an update on who's been offered the vaccine at the moment. So all over 18s are being offered the vaccine, and then more recently that's been extended to 16 and 17-year-olds. And then even more recently, 12 to 15-year-olds. So 12 to 15-year-olds who have particular underlying health conditions that put them at higher risk of serious COVID infection, and also 12 to 15-year-olds who are living in a household where someone in that household is at income. And you can find out at the very end of the slides, there's kind of links to NHS Inform, which is the best place to find out kind of who's eligible and how they can access their vaccine. Next slide, please. Great, so just an update as to how we're doing. So I've lifted these slides from Public Health Scotland. So what this first one just shows is it shows all the local authority areas along the bottom of the screen, and then the percentage of the population that has received their first and their second dose. And we're looking at over 40s here. So just to bring out Edinburgh as an example, we can see that 96% of the population have had their first dose of the vaccine, and about 91% of the over 40 population have had their second dose. Next slide. And then if we just extend how we're doing to include kind of some of the younger age groups, we can see that in the younger ages, it's like there's a bit more work to be done. So again, looking at Edinburgh, we can see that dose 1, about 84% of over 18s have had their first dose, but only 65% of the population have had their second dose. And some of that will be to do, you know, this population has only more recently been offered the vaccine. But actually, if you look across the board, so if you look, for example, at West Lothian, which is on the very right-hand side of the screen, you know, their uptake rates, they're getting 92% for first dose and 70% second dose. So it would suggest that across the board there's still more work to do, but in the city of Edinburgh as well, it looks like there's definitely more work to do as we maybe aren't getting the same rates as other local authority areas. Next slide, please. And just for interest then, just looking at the age group, so I've pulled out City of Edinburgh and then I've focused in and broken down the age groups. So we can see that coverage is lower in the lower age group, so the 18 to 29 cohort in particular is where our uptake is lower. And next slide, please. And just providing a breakdown then by sex. So you'll see kind of this graph divides the three age groups, 18 to 29, 30 to 39, 40 to 49, again comparing first and second doses, and then in males and females. And you'll see there's not a huge discrepancy between males and females, although consistently it looks like the uptake in males is just a wee bit lower than females. Next slide, please. So then just to give you an update on booster vaccination. So this is obviously, you'll have heard a lot of conversations about this. So the most recent guidance that we have from the JCVI, or who are the national kind of body of experts on vaccinations, it was in June 2021. So a booster programme is looking highly likely, but the details of that are still being confirmed. But it is most likely that we'll see a booster programme begin in the early autumn, and that we'll see that following kind of a priority list similar to what we saw with the COVID vaccines. So likely that, you know, older adults who are most at risk of severe disease will be prioritised alongside, you know, our health and social care staff who are at risk of exposure, but also working with vulnerable people. So health boards are currently, you know, making plans for the autumn season, and we're also waiting to hear for kind of the firmer guidance about who exactly is eligible, when, and what vaccines they'll be offered. Next slide, please. Then another update just on vaccination status. So obviously at the minute you can go onto NHS Inform and you can request a printed copy of your vaccination status, or you can phone the helpline to get a copy of that. And at the minute, the kind of things that vaccination status is being requested for is foreign travel, and also, as we'll hear later on, guidance on self-isolation has been updated, and actually your vaccination status can dictate how long you might have to self-isolate if you're identified as a close contact. Next slide, please. So as I mentioned, you know, and as Judith mentioned, there's still more work to be done, and sometimes it's helpful to think of it in this context of vaccine hesitancy, which I'm sure is a phrase we've heard over and over again. So there's 3 C's that kind of cover vaccine hesitancy broadly, and when we think about what we need to do to support and promote vaccine uptake, it's helpful to think of these C's. So the first one is confidence. Does an individual trust that a vaccine is safe? Does an individual trust who is asking them to get the vaccine? And does an individual trust and have confidence in the person that's giving them the vaccine? So that's where we have to have open and honest conversations about side effects and provide people with the correct information. And we need to use trusted members of communities to communicate vaccination messages. Next slide, please. The second C is complacency. So that's something, especially in our younger cohorts, we might see. And it's an understandable stance to take. You know, my risk of severe COVID is relatively low, so you know, why would I take a vaccine? So we need to have honest conversations with our young people that, you know, actually young people can still get COVID, they can still get severe COVID, and actually they can potentially pass it on to those around them. So it's having conversations to make people aware of their risk of disease and of the benefits of vaccination for them and those around them. Next slide, please. And then the last one, the last C, is convenience. And really this is the one that we absolutely can master. So it's about making vaccines convenient for people. It's about delivering them at a convenient time of day, convenient day of the week, in a convenient location, and making access to information easy and accessible for everyone. Next slide, please. So to demonstrate that, and just to give an update on where Lothian are at, you know, we've seen that we've been expanding delivery models. So we now have drop-in clinics, so people can be much more flexible about where they attend and when. And we've also seen, you know, mobile vaccination buses offering vaccines in kind of frequently attended places like big retail centres. We're also starting to have, you know, smaller pop-up clinics, this kind of vaccine taxi option in some of our, for example, places of worship. Lothian are currently piloting 4 community pharmacies delivering vaccinations, and we've also used kind of empty retail units. So that's trying to overcome this idea of making vaccinations accessible to all. Next slide, please. So yeah, there's still more to do, but I'm going to hand over to Judith next to chat about COVID testing, and then at the end we'll come back and chat again about you know, how we can all be involved and do this together. Thanks so much, and apologies for my brief departure.
Thanks, Alice, that was great. Just before, there's only half a dozen slides here, it won't take long, but I just want to acknowledge Sita Reddy, who's in the audience somewhere, who's one of our consultants in public health and health protection. She's helped with the content of the slides, and she's around to be part of the FAQs as well. So I just wanted to acknowledge that. So if we'll get the first slide up, please, that would be great. So I think, as I said at the beginning, it's a very complicated and complex landscape. So we didn't want to flood you with, if I'm this, this is the message. If I'm this, this is the message. So there's two simple rules to think about when it comes to testing. And one is, have I got symptoms or have I not? So if you have symptoms, you need to get a PCR test. The guidance still is that the symptoms of COVID are fever and high temperature, loss of taste or smell, and a neuropersistent cough. And actually they haven't changed. I know we're seeing people who have other symptoms as well, you know, that get reported, but they are the key symptoms. So if you have any of those, we would recommend that you get a PCR test. You shouldn't get a PCR test if you've had a positive result in the last 90 days, because that can impact on the test results. But again, if you're not sure about that, it's always best to get advice and follow that. But generally the rule is you shouldn't get a test if you've already tested positive in the last 90 days. There's information in the slides here, and again, we'll send this out. You can either book your test by logging on or by calling a number. And again, I know some of the projects in the third sector have helped people to log on where there's digital issues, or maybe help with phone calls or whatever. So again, that can be a gap for some people. And the key thing about isolation is that you and your household must self-isolate as soon as you book a test. So as soon as you're symptomatic and you've booked a test, you have to isolate until you've had your results, and that's you and your household. And if you get a positive test result, that means you have to isolate for at least 10 days. And I'm not going to say any more about, well, what if I'm this or what if I'm that, because actually once that happens, there's a whole kind of mechanism that swings in by the Test and Protect service. So if you get a positive test, they will contact you, and then they'll give you more information about recent contacts and what's required. And I think because this changes so frequently, that's probably the safest thing that you should be following. So the next slide. This is just a map of where you can get PCR tests in Edinburgh, but I would say this changes a little bit as well. We've got Kerry and Aisha on the call, who also work in the public health team, and they've been working with Ian and colleagues. So twice a week we push out information about where you can get tested and where you can get vaccinated. So if you're not on that list, you know, make yourself known to Ian or someone and make sure you get that. But generally, this is where you can go for PCR testing. You can see we've starred Usher Hall. We've just recently suspended that because a lot of venues now are being returned to their original use, which is great from a social well-being point of view. So that's been stood down, and we've actually got an interim measure in there at the assembly rooms around that. So that's just, you can see though, the idea there is it's actually spread across the city, but that's what we're trying to do to make access easier. Next slide. So if you don't have symptoms, you should use what we call a lateral flow test. Sometimes they're called LFT, some people say LFD, lateral flow device. This for me is very important. This is our route to stay out of COVID and to kind of reduce the transmission chain. So we know that around 1 in 3 individuals with COVID do not have any symptoms. And they're the people that are wondering about and they don't know anything about it. So if we open up testing to get everybody to test themselves on a fairly regular basis, we can pick these people up, and we are doing that, and that helps to take those routes of transmission out, and it helps to break chains, and that's how we reduce the spread. So regular testing and of course vaccinations, as Alice said, will help us to kind of live with COVID. This is the new norm for at least a little while. And we know now that schools and colleges and universities and workplaces, now that they're becoming operational, there's more and more need to be doing that. So when you take a lateral flow test, if you do one and collect one from one of the samples, you'll usually get your results by text or an email within about an hour, so it's fairly rapid. If you do it at home, it takes about 30 minutes maximum. It's fairly easy to read, but again, I know some of the projects have maybe helped people to understand how to take tests at home. The important thing about if you're doing tests at home is we need you to log your results. So again, people, if you're giving out tests and you're talking to people, it is really important that they log their results, even if they're negative, because that helps us to build a picture of what's happening with COVID in our area. If you test positive with a lateral flow test, you kick into that kind of, okay, I've got symptoms and I need to have a PCR test. So if you test positive on an LFT test, you and your household must self-isolate and you have to arrange a PCR test. So it's back to that. It's kind of what was said in the slide before. So the next slide. So there's lots of ways that you can get lateral flow tests, and we've been trying to open this up. We've had a bit of feedback that people are struggling to get them and they're not sure where. So you can go to one of the asymptomatic mobile test units that are dotted around the city. And again, we'll push that out twice a week, or there's a link there. You can order them for home delivery from websites. So again, some of your contacts might want a little hand with some of that. And there's quite a few pharmacies provide them as well for pickup. And again, there's links to that. And also we've been really grateful for Edinburgh Volunteer Centre and the Lothian Association of Youth Clubs. They are actually now pick-up points as well, and from what I can gather, that's going well. And actually people that are coming for those tests are actually people that maybe were struggling to access them before. So it shouldn't be difficult to get access to lateral flow testing, but if you're picking that up from people in the community, do let us know. And just to remind people that it is free. I think there's some mixed messaging, you know, people have to pay if they're going on holiday and things, but this testing is free, so it shouldn't be a barrier to getting it. Next slide. So this is just an overview. So I know you can't read it very well, but this is an overview of what we're pushing out twice a week that Kerry and Aisha are doing. So it'll tell you about vaccinations, it'll tell you about testing. So it's important to be getting this if you can. And then the next one, I think someone's mic's just come on there. I can hear a bit of noise. So the next one, Ian. And then just, you know, it is just, as I said at the beginning, a big thank you. And you, I hope you've understood by kind of what we've said, and you probably know this already, you are absolutely crucial to help us particularly address inequalities in terms of accessing testing and vaccinations. So we know that you're the voice for the communities that you support, and you know about some of the barriers they're facing. So Ian and Kerry worked on a survey with yourselves and we're taking some of that feedback. But again, if you're getting feedback, please pass that back through. Alice talked about being a trusted source and a trusted source of information. Certainly that's often the case for a lot of you. So it's about you sort of almost having these informed conversations with your contacts. And again, the fact that a lot of you have stepped forward and we're using your locations for vaccination and testing and pushing out information as well through your networks. So I think the last slide now from me. Yeah, so we'll send this around, and this is just where you can get information about vaccine and testing, and there's things like videos you can watch on how to take tests. So these are links that again we'll share and you might want to chat to people about. I think the other important thing about testing is when people are positive and need to isolate, that's easy for some people but harder for other folks. So I'm just going to hand over to Lisa now to talk about what support is available to actually help people to isolate when they need to.
Hi, thanks Judith. So hi everyone, I'm Lisa Hastings and I don't have slides, but what I have got is a document that I'm going to share after the session. So I work for City of Edinburgh Council. My role is I'm the customer contact manager, so I'm responsible for contact centre and our face-to-face teams, which are currently working in resilience centres. And actually just quite in the last week or two, for anybody who visits face-to-face, actually we're giving some lateral flow tests out, and there are people that are coming in who are potentially from homeless and different other, so we're starting to do some of that face-to-face, so that might help with some of the testing as well. But the reason that I'm here is to talk about the isolation support. So the key thing from Edinburgh perspective is we've got different opportunities for people to make contact with us, as well as we'll make contact with individuals. So initially, if someone's asked to isolate, we are contacted through public health, and we have daily updates and reports. So if someone's asked to isolate, we will do an outbound call or an outbound text to an individual to offer them support up front. And that could be anything to do with any council services or funding or any other needs. So that happens. In addition, if someone doesn't use that opportunity, we will give them some other updates. So we can tell them that they can call us on our vulnerable phone line. and also people who are eligible can apply for an isolation grant. Now, to give you some figures, just looked at July. July, for people asked to isolate in Edinburgh, we made 7,843 outbound calls. Now, actually, only 1% of those calls result in somebody saying at that point they need help. However, we then see an influx of people who've been asked to isolate who look for the grant application. And during July, we received 3,036 applications. We awarded 1,238, and that was 619,000 was actually paid out to people who were asked to isolate. There are certain qualifications to be able to apply for that, whether you're employed or self-employed, and being asked through Test and Trace to Test and Protect to isolate. But I'll share that document with you. But I thought it was just important to give some of those headlines that there is support there, financial. And also, if someone isn't eligible for the isolation grant, we've also got Scottish Welfare Fund, so crisis applications. And we also work with partners and third sector, of which again have been incredible for pharmacy delivery during that isolation period. Things like dog walks, food, so there's various different things. So as I say, I was just asked to come along today and just give a flavour of what we've got available, but I'll share the document with everyone as well, and I'm happy to answer any questions that MD has on what the council can do to support people who've been asked to isolate. And apologies, I'm on my mobile, so I feel like I'm really close to the screen. I couldn't go on my laptop, so apologies if I'm really close to the screen on my mobile. And that's all I would share, if that's okay. Happy to hand back to, is it yourself, Judith, to host the question and answers? Or?
I think Ian's facilitating the QA bit.
Thanks, guys. Thanks, Lisa. Thank you, Alice, and thank you, Judith. So if we stop recording there,